Welcome to BFR Radio, a podcast dedicated to all things blood flow restriction training. This podcast is proudly sponsored by the BFR.co, where if you want to buy your own BFR cuffs, access online BFR training programs, or you want more information about this type of training, this is your one place to go. And I'm your host, Dr. Chris Gavilio. Welcome back. Hope you're doing well. And today we're picking up right where we left off, because last episode we opened a door that I think a lot of you wanted to walk through further. Last time we looked at how BFR training combined with core stabilization exercise can drive meaningful hypertrophy and strength gains in people with non-specific chronic low back pain. We saw that leg-applied cuffs triggered systematic adaptations, specifically increased activation and thickness of the transversus abdominis, multifidus, and gluteus maximus. Just a quick refresher from the last podcast, the transversus abdominis acts like a deep muscular corset wrapping around your midsection to stabilize your core. The multifidus, the small cable-like muscles running right along your spine to keep it aligned, and the gluteus maximus, the large, powerful muscle in your backside that drives lower body movement. Overall, seeing these changes alongside significant drops in disability scores in just 4 weeks was a compelling proof of concept. Today, we go a step further. We're asking a more pointed question. How does low-load BFR training actually stack up against traditional heavy-load resistance training when it comes to core muscle strength, pain, and function in athletes who are already training through chronic back pain? Because that's a very different population to the general chronic pain patient. These are people who are already in the gym, already competing, and still hurting. And don't worry, if you're not an athlete, I think this actually will still apply to you as well. The paper we're covering today is titled The Effect of Blood Flow Restriction Training on Core Muscle Strength and Pain in Male Collegiate Athletes with Chronic Non-Specific Low Back Pain. It was published in the Frontiers in Public Health in January 2025. Let's get into it. To refresh our memory, chronic low back pain is one of the most prevalent musculoskeletal conditions on the planet. We're not talking about the occasional tight back after a long drive. We're talking about pain that persists for more than 12 weeks, localized between the lower ribs and the gluteal fold. And of that group, roughly 85% fall into what's called the non-specific category, meaning there's no identifiable structural pathology, no fracture, no tumor, no nerve root compression explaining the pain. For athletes, this creates a particularly thorny problem. Strength training is an important part of their training program. It is well documented that to drive meaningful strength adaptations, athletes need to train at loads of at least 70% of their 1 repetition maximum. But here's the catch. When your core muscles are already inhibited and your lumbar spine stability is compromised, loading at that intensity can worsen muscle imbalances and increase injury risk. Therefore, we typically see athletes either grind it out, change the exercise to deload the back, or lighten the load to avoid aggravating their back pain. Muscle wasting or atrophy and the buildup of fat within the lumbar multifidus and transversus abdominis are consistently implicated as primary contributors to pain and instability. These deep stabilizers lose their ability to anticipate and respond to spinal loading, and the superficial global muscles, that's your rectus abdominis or your six-pack, your rectus spinae group, which sit along the back either side of your spine, they try to compensate, creating a chronic pattern of overload, fatigue, and pain. It becomes a vicious cycle. Pain leads to inhibition. Inhibition leads to weakness. Weakness leads to instability. Instability leads to more pain. So the question this research team asked was essentially, can BFR training break that cycle without the joint stress that comes with heavy loading? In this study, they recruited 26 male collegiate athletes with a chronic non-specific low back pain diagnosis that had persisted for more than 12 weeks. All of the participants had a training history of 3 to 6 years. They were randomly assigned to either the low-load BFR training group or the heavy load resistance training group. In other words, they were training like normal. The two groups were well matched with no meaningful differences between them at baseline, and they avoided all other physical training or therapy during the 4-week intervention. Baseline and follow-up testing occurred 24 hours before and after the formal training block. In the study, both groups completed the same 4 exercises: deep squat, lat pull down, bench press, and machine seated crunch. The frequency was exactly the same, 4 sessions per week for 4 weeks, training on Monday, Wednesday, Friday, and Sunday. That's 16 supervised sessions in total. And here's where the groups diverged. The BFR group trained at 30% of their 1RM with 4 sets per exercise using the classical 75 rep protocol. The first set here was 30 repetitions, followed by 3 sets of 15 reps. The rest intervals, they were short, 60 seconds between sets. The cuffs, they were 8 centimeters wide and placed on the upper thigh or the arms, depending on the exercise. And the inflation pressure was set at 180 millimeters of mercury, which they said corresponded to 70% of arterial occlusion pressure. Importantly, the cuff pressure was inflated throughout the exercise and released between sets. Just quickly, this protocol for me actually wasn't totally clear. Was the cuff inflated for 1 set only and deflated during each rest period? I wasn't quite sure. In an ideal situation, training low-load BFR, it's best to keep it inflated continuously. Therefore, reading between the lines and my own suggestion would be to inflate the cuffs for all of the exercise sets and deflate them after completing the first exercise. In other words, you do the deep squat, keep it inflated for all the sets, then deflate it and reinflate it for the second exercise and so forth. And in the second high-load traditional resistance training group, they trained at 70% of their 1RM, performed 4 sets of 15 repetitions, and had a slightly longer 90-second rest interval. In this group, once again, they had no cuffs, no occlusion. The outcome measures, they were pretty comprehensive. Firstly, they looked at pain, and this was assessed using the visual analog scale. Here, participants were asked to mark a place on a 10-centimeter line where 0 is no pain and 10 is severe pain. They also used a functional disability score, which was assessed using the Austri Disability Index. This is a 10-item self-report questionnaire scored out of 50, covering domains of pain, single-item function, and overall daily living limitations. A score of 0 indicates no functional impairment, and higher scores indicate higher disability. Core strength endurance was evaluated using the McGill Endurance Test Battery. This measured isometric hold time for trunk extensors and flexors. The trunk extensor exercise is like performing a back extension where the body is parallel to the ground, whereas trunk flexion is just like a sit-up, where the body is held at 60 degrees in relation to the ground. Then they also assessed core strength, and they used a specialized machine called an isokinetic dynamometer. Picture sitting in a high-tech mechanical chair with a padded lever resting against your chest or back. You push against this lever as hard as you can to bend forward or lean backward, depending on where the padded lever is. But here, the difference is that the machine strictly controls how fast you can move. The set speeds of movement is what they call angular velocity. The researchers tested the participants at 3 different angular velocities, 30, 90, and 120 degrees per second. To visualize that, 30 degrees per second is a slow, heavy grind, while 120 degrees per second is a much faster, sweeping motion. No matter how hard you push, the machine won't let you move faster than the exact speed that's dialed in. By using this setup, they were able to safely measure the participants' peak strength, specifically peak torque relative to body weight, for both the trunk flexors, think an abdominal crunch, and extensors, think of a back extension. And then finally, with this information, they calculated a flexion to extension ratio to see the balance of the strength between the front and the back of the core at each of those speeds. So the difference between this study and the study that I reviewed last is that they did a lot of core exercises. And whereas the study that I'm reviewing for this episode, They only had one core exercise and the rest was strength-based. So this is going to be really interesting in terms of what they actually found out. And onto that, we'll have a look at the results now. Firstly, we'll look at pain intensity, and this was measured by the visual analog scale. For the BFR group, it dropped from 5.54 out of 10 before training to 3.92. This was a statistically significant reduction with an effect size of 1.44. And if you're not into your statistics, don't stress. For context, if you have an effect size which is above 0.8, it's considered large by conventional benchmarks. So 1.44 is a very large effect. In the clinic or on the training floor, this translates to athletes reporting noticeably less pain during and after activity. A reduction of roughly 1.6 points on a 10-point scale in just 4 weeks, which is the kind of change that meaningfully affects training participation and quality of life. The heavy load group also reduced their pain from 5.46 to 4.62. This was also significant, but it was a less effect size, moderate. So both interventions worked for pain, but the BFR approach produced a larger effect. Looking at functional disability, the Austrian Disability Index score in the BFR group dropped from 28.8 to 21.62. This effect was significant and very large. To put this into practical terms, the drop of over 7 points on the index represents a meaningful shift in how these athletes were able to carry out daily activities in sports-related tasks. In the gym, this translates to athletes being able to train more consistently, complete more of their normal training program, and report less interference from back pain in day-to-day life. The heavy load group in the disability index, it also improved from 29.4 to 27.4. It was significant and meaningful, but substantially smaller than what was seen in the BFR group. Moving on to isometric core endurance, both groups improved trunk extensor hold time by between 8 to 16 seconds. And in the gym, this translates to athletes being able to maintain spinal stability under fatigue for longer, which is directly relevant to injury prevention and performance. For trunk flexor endurance, so think sit-up type movement, both groups improved between 3 to 5 seconds. These changes, although positive, weren't significant, suggesting that the extensor chain was the primary beneficiary of this training block. Now let's look at isokinetic strength, and this is where things get nuanced. At 30 degrees per second, that's the slowest velocity that was tested. Only the heavy load group showed a significant improvement in trunk extensor peak torque relative to body weight. Whereas at 120 degrees per second, that's the fastest velocity tested, only the BFR group showed a significant improvement in trunk extensor peak torque relative to body weight. So we have a pattern here. Heavy load training drives greater slow velocity extensor strength, whilst BFR training appears to have an advantage at higher velocities. The flexion to extension ratio also supported this same pattern. In the gym, the higher velocity findings for BFR translate to something really interesting. Those athletes may be better equipped for dynamic, fast movement activities, the kind of athletic tasks that actually mirror sport. Slow velocity strength is more relevant to heavy lifting and postural stability, while fast velocity strength maps onto explosive and reactive movements. Now here's a reflective question I'd like you to sit with for a moment. If you're working with an athlete who's in pain, but still has to train and compete, which matters more to you in the short term? Getting their pain and disability down as quickly as possible, or maximizing their raw strength numbers? Because these results suggest that you may not be able to fully optimize for both simultaneously, and understand that trade-off is central to good clinical and coaching decision-making. Now that we've gone through the results, let's zoom out and think about what this study is really telling us. First, the pain and disability findings. The BFR group's reductions in both the visual analog scale and the Austrian Disability Index scores were substantially larger than the heavy load groups, with effect sizes nearly double in some cases. This is consistent with the broader BFR literature in musculoskeletal pain populations. The reduced mechanical loading appears to allow people to train without the pain-sensing input that heavy loading can generate, while the metabolic and hormonal cascade triggered by BFR still drives adaptation. There are several proposed mechanisms here. BFR training creates a hypoxic environment in the muscle, which leads to the accumulation of metabolites like lactate, hydrogen ions, and inorganic phosphate. This drives the nerve fibers that sense pain and muscle fatigue, which in turn drives systemic hormonal responses such as growth hormone, insulin growth factor 1, and this in turn supports muscle protein synthesis. Simultaneously, the low oxygen hypoxic stress created by the BFR cuffs promotes preferential recruitment of fast twitch muscle fibers at loads that would normally only recruit slow twitch fibers. This may explain why the BFR group saw strength gains specifically at the higher isokinetic velocity of 120 degrees per second. That is, fast twitch recruitment was being trained. The fact that trunk extensor endurance improved similarly in both groups is also important. It tells us that the McGill-style endurance tasks are somewhat load agnostic. In other words, you can achieve similar isometric endurance adaptations whether you're training heavy or training with BFR and light loads. That's practically useful because it means that clinicians and coaches don't need to choose between the two methods on endurance grounds alone. The exercise selection is also worth noting. Deep squats, lat pull downs, bench press, and machine seated crunches. They're global movement patterns, not the deep stabilized focus progressions we discussed last episode with the drawing in and quadruped work. I personally don't program deep squats, and the article didn't have any information about the depth of the squat. However, from my own experience, this would have application to squats of a more moderate depth of around 90 degrees or even parallel. The BFR cuffs, they were applied to either the arms or thighs depending on the exercise, rather than being fixed to the thighs throughout for a systemic effect. However, this is a different training protocol to the previous study we just covered in an athletic chronic low back pain population, showing that BFR training at low load can match or exceed heavy load resistance training for pain, disability, and certain dimensions of strength, whilst presumably reducing spinal joint stress. For athletes who need to keep training through pain, that's a meaningful finding. So let's bring this home with 3 clear takeaways you can carry out of this episode. First, in male collegiate athletes with chronic non-specific low back pain, 4 weeks of low-load BFR training produced extremely significant reductions in both pain intensity and functional disability, with large effect size and outperforming heavy load resistance training on those measures. If pain reduction and restoration of daily function are your primary short-term goals, blood flow restriction training at 30% of 1 repetition maximum may be a smart choice. Second, both BFR training and heavy load resistance training improved isometric trunk extensor endurance to a similar and statistically significant degree. Neither approach had a meaningful impact on trunk flexor endurance over 4 weeks. This tells us that in the early phase of rehab, you can build back extensor endurance without needing to load heavily, which is a useful lever when your athlete is pain limited. And third, the isokinetic strength profile differs between the 2 different training methods. Heavy load training drove extensor strength at slow velocities, the 30 degrees per second, while BFR training drove extensor strength at high velocities, 120 degrees per second. If your athlete's sport requires explosive high-speed trunk strength, there may be a specific role for BFR training in their program that goes beyond just pain management. Before I go, back to the reflective question. Although the podcast is reviewing this article, as coaches, athletes, or practitioners, it's time to get practical and apply it. If this was me, I'd approach training for athletes with low back pain in the following way. Thinking back to our previous episode, we have our solid core-specific program It's thorough, progressive, and proven. This episode highlights positive effects for low-load BFR strength-based movements that are lower and upper body. If we just look at the lower body exercises for a moment, these are exercises that we would typically program for athletes and is something that we need to start to move towards at the higher end of the loading spectrum. Therefore, in acute phases, we continue barbell squats at the light load. Single leg exercises such as lunges, step-ups, and Bulgarian squats, they can continue using light loads, and they're loaded through either using a dumbbell or a barbell. In athletic populations, load is still very important. We can therefore continue our heavier loaded lower body exercises that don't load axially through our spine. This is where we think about exercises such as the leg press, a belt squat, a prowler, or a sled push or pull. You'd still use the cuffs for these exercises. You want to still go heavy, but what you would actually do is you just drop the load a touch, which I think will be really important in the acute phase because the athletes might still have pain in their lower back and they'll be inhibited with just movement in general, but we can still provide some kind of heavy mechanical stress on the body, which once again, I think is very important for performance. And I've actually covered the positive effects for high load BFR training in previous podcasts where we looked at the positive benefits for movement velocity in particular. And for the upper body, you just train as normal and as the back permits. You'd keep the loads high, but you'd still keep the BFR cuffs on. Now we have a truly comprehensive training program that does its best to maintain strength levels, that has athletic performance transfer, whilst importantly addressing the core, pun intended, issue. However, that's the difference between the real world and what we read in these articles. And that's all for this episode. If you have any questions to this, you can get in touch with me through my website, thebfr.co, or my socials or our socials at thebfr.co. You can also purchase your own BFR cuffs from our website at www.thebfr.co. And lastly, before I go, a couple of favors from me to you. If you know of someone who would benefit from this episode, please share it. And if you're enjoying the podcast, please give it a rating on iTunes. Thanks for listening, and remember to keep the pump.